Hi there, everyone. How are you enjoying this wonderful wintry New England afternoon? Got a lot of snow out there today. Anyway, I wanted to go live today because a few weeks ago I posted a post about starting chemo treatments, and the amount of response I got was overwhelming, heartfelt encouragement. And many of you still continue to reach out to me to see how I'm doing. And I've been so overwhelmed by the amount of people that have reached out. So I've decided that for those reasons and for a few other reasons that I wanted to share my story live. So I'm surprised that I'm doing this because, as many of you know, if you know me, I am an extremely private person, especially when it comes to my private life. However, I have come up with 4 reasons why I've decided that this would be a good platform and an outlet for me. So reason number 1, I guess this will serve as some sort of, therapy for me. Reason number 2, my kids. They all live out of the country. I'm sorry. My son and my son Sean and my daughter-in-law Jess and my new grandbaby Adeline live in Florida. My son Brian, daughter-in-law Stephanie live in Texas, and my daughter Lindsay and granddaughter Harper live in Ohio. I know they wish that they could be here to support me, and they can't. So I guess this is the next best thing. Reason 3, you guys. You guys have been amazing. You've been checking in on me and just overwhelmed. So I wanted to share my story with you. But the 4th reason, and the one that's probably most important to me, is that I'm of the mindset, if I have to go through this, I need some good to come out of it. Whether if it's just to bring awareness to the disease, maybe support someone watching who is going through it, perhaps to stop somebody from blowing off a mammogram appointment, whatever it is. If someone can relate, then I feel as though something good has come out of it. So I'm going to tell you my story, and I'm going to start from the beginning, the diagnosis. So every year I schedule my doctor's appointments, faithful, go get the works, the physical, the OBGYN, the mammogram, all of that. So in August of last year, I had my appointment scheduled. My first one was to see my MD for my physical. So everything checked out good. She asked if I was having any problems. I told her that I had recently developed some breast pain. Of course, she asked me right away, when are you going to have your mammogram? I said, I always have it every year, but matter of fact, after I leave you, I'm going right next door and having the mammogram done. So she said, well, okay, then let's go ahead and do an ultrasound. So she prescribed the ultrasound, went in, did what I had to do. 2 days later, I got a phone call from the doctor, and she stipulated that the ultrasound did find something, and that she was referring me to a breast oncology surgeon. So, of course, that was a little bit frightening for me, but, I didn't have any information yet. So I agreed and said I would make the appointment. And it was a good thing that she suggested the ultrasound, because she told me that the mammogram didn't find it. So had I not had the ultrasound, if she had not been proactive, it could have been another year or maybe even longer before this was found. And I need to stop my story right here for 1 minute to talk about this subject, and it's called dense breast tissue. It is very important if a woman has dense breast tissue that they follow up their mammogram with an ultrasound, because a tumor will not be found under dense breasts. So talk to your doctor, and if you have this, then you need to make sure that you add the ultrasound to your yearly regimen. And also check out Are You Dense? It's an organization founded by a local woman called Nancy Capello, who was diagnosed with stage 3 and 13 lymph nodes involved. And she was faithful doing mammograms every year, but it was never caught until it was progressed. And the reason why it wasn't caught is because she didn't have the ultrasound done, and the reason why the ultrasounds weren't done is because they weren't paid by insurance companies, so her doctor never suggested her to have it done. Her journey inspired her to do something about this, and she founded this organization, and she has been fighting over a decade to mandate insurance coverage for an ultrasound for women with dense breasts. So go check out her story. It's very inspiring. She's been a pioneer in this movement. And in fact, when I got diagnosed, I reached out to her, and she was so welcoming. Took time to speak with me, and even invited me to come to a support group that she belongs to. So for her story and for more information on this issue, go to rudense.com. So I'm sorry I got off topic, but I thought that was important information to share. So back to my story. August 9th, I have my appointment with the breast oncologist. She has viewed my films, and she's indicated that they need to do a biopsy. So of course we do the biopsy right there. I don't wait. Basically, she takes a large needle, inserts it in my breast, and removes a portion of the tumor to send out to the lab for testing. They basically say, we have to send this out. We won't know for a week. We'll come back in a week, and we'll give you the results. So I go back on the 16th, a week later, for the results. I hadn't heard from them the whole week, so I was feeling a little nervous. Figured that if it was good news, they'd call me, and they hadn't. So, and of course, that day is when I was given my diagnosis. Ductal carcinoma in situ and invasive ductal carcinoma. 2 types of cancer. The in situ means that it's still in the milk duct, and the invasive means that it has, penetrated into the breast tissue, and it created a tumor that was a little bit over 1 centimeter large. Still very small, and the good news was considered stage 1. But it was a high-grade tumor, making it invasive. The surgeon further explained the testing done on the tumor and told me that they usually test for hormone indicators, because most breast cancers are created or fueled by three hormones, estrogen, progesterone, or HER2. And depending on which hormone will indicate the type of treatment that you get. My lab results reveal that the tumor was not created, my tumor was not created or fueled by estrogen nor progesterone, but the HER2 came back what they called equivocal, so inconclusive. So I had to have another test done called the FISH, which would take again another week, more waiting. So we scheduled another appointment for the following week and went home. But at this point, I know that now I have breast cancer. I don't know what kind or how the treatment's going to go, but I know I've been diagnosed. My husband was with me, and needless to say, we had a lot to process. I didn't tell anyone because I felt I needed to know more, and I needed to know what I was up against and what the treatment plan and what the process was going to be. And I really needed to kind of just sit with this by myself and kind of like wrap my head around it. I worried most about telling my parents who are elderly, and especially my kids, all who live, as I said, out of state, and this couldn't be a face-to-face conversation. This needed to be either a phone call or, best case scenario, FaceTime conversation. So this ate at me, and so I decided that I needed to have more information to at least be able to follow up the bad news with what the plan was. And I needed to feel ready to be able to deliver that information. So the FISH report came back in August, late August, and it came back negative. So now I'm considered triple negative cancer. And I know you're thinking that's probably good news, but it's not, it's bad. Because the triple negative, the 3 hormones, were not the indicators for the tumor. So that means that they don't know how to treat it. If it had been fueled by the hormones, they know an exact plan and they know an exact treatment. Triple negative cancer, breast cancer, also has a high reoccurrence rate. And get this: if and when it does come back, it usually goes towards a major organ like your lungs, your bones, or your brain. So I know it sucks, but it is what it is. So I asked my doctor what's next? And they said, well, since it wasn't hormone created, it's triple negative, then we need to do genetic testing. And if you remember a few years back, Angelina Jolie had this issue, and she went and got tested and did find that she happened to have a mutated gene. And she was proactive about her treatment and just went in and had everything removed. So off I go to get the genetic test done. They can't go any further because without knowing if it is gene related, then they don't know how to treat it. So, and the problem with the genetic test is that it takes 4 to 6 weeks for the results to come back. So I go off and do that. And so at this point now, I've had this diagnosis and I've been sitting with this for over a month. Only my husband and I know. And we haven't told anybody. And now we're looking at waiting another, 4 to 6 weeks. And we just decided we just can't do that. So we're going to go with what we know and tell the people the closest to us, our parents and our kids. So over the last weekend of August and the Labor Day weekend, I went through the arduous chore of having to deliver this horrible news to everyone. It was the hardest thing I ever did, especially telling my elderly parents and my kids. But I got through it with the help of my husband, and so that was done. Late in September, the genetic test came back, and that came back negative. So that's good. I don't have to worry about a relative of mine, my siblings, my kids that have to worry about this disease. So I asked the doctor, if it's not genetic, then what caused it? What's next? And they said they don't know. Triple negative cancer is one of the cancers receiving a lot of attention right now, and research to find the cause. They say it could be anything like environmental, diet, or just bad luck. So you ask yourself, okay, how did I get cancer and how did I get this one? I've always been healthy. I don't take a pill for anything. I eat well. I don't do processed foods. I exercise. No blood pressure, no diabetes. I don't even like to take an aspirin for headache. So how did this happen to me? And mind you, I have had several opinions on my case from top oncologists all over the country, from Boston, Atlantic, New York, and Chicago, and they've all touted the same thing. They just don't know enough about this type of cancer. So I swallow the not knowing part and concentrate on getting to the treatment. The first step is obviously to remove the cancer. My docs are recommending a lumpectomy because the tumor is so small, and it's in a less invasive surgery, less risk, no infection. The surgery is done October 17th. I go in, it's a one-day procedure. I go in the afternoon. They take out the tumor. The tumor is the size of a dime. She goes in and takes out the tumor, and then she takes out more tissue around the tumor to make sure that if there's anything that's not visible by the eye, that's microscopic, hopefully they're getting it all. They take that, and at the same time, they then have to test for my lymph nodes, so they put a dye in me to mimic what the cancer would do and which lymph nodes it would travel to, and any lymph nodes that light up, they remove those lymph nodes and send them out for testing to see if they've been infected. So come home that afternoon, have to wait for the lab results on these two tissues, so another week. A week later goes by, I get a phone call, the lymph nodes were clean, which is terrific news. However, the margins were not. The extra tissue that was taken around the tumor, they still showed under the microscopic, they did show some cancer cells. So I have to do another surgery. And my options are I either have to do another re-incision and do what's called a margin extension, which is just taking out more tissue, or do a full mastectomy. I decided to do the margin extended. That's what they recommended. They said, again, because the mastectomy is much more invasive. You have to wear drains. There's a high, good risk for infection, higher risk for infection. So I decided I would try the margin again. Did that. That happened on October 31st. Same drill. Go in the morning, come out in the afternoon, wait a week, get the results. The margins came back positive. So at this point, I had no choice. I had to go in for a full mastectomy. The mastectomy was done on November 21st. Since it's invasive, I had to stay 2 days in the hospital. They did have to put a drain in me. I was released on Wednesday, the day before Thanksgiving, and came home. Dealing with the drains was tough, but I had visiting nurses and my sister, who was a CNA, who was a big help to me. Once the drains are removed, then I need to heal from the surgery, and the next step is to get information on the post-surgery treatment. And I have to go see my medical oncologist, the doctor that actually administers and prescribes the therapy. So in December, I went to go see her, and because my tumor was over 1 centimeter, although small, but being it's triple negative, she recommended chemotherapy. The chemo regimen that I'm on, I have 2 regimens. The first round is a idramycin and Cytoxan, also known as AC. 4 times every week, 4 times every other week, so it will take 8 weeks to complete. So this part of the chemotherapy is really the strong part. So with triple negative cancer, because they don't know how to treat it, they kind of throw the big treatment plan at you to hopefully cover all the bases. So this first regimen is the tough one. That's why I'm 1 week on and 1 week off, so that I could repair on that week off so my body can get strong enough. After that, I'm done with that, then I go to round 2, which is Taxol, and that's for 12 weeks, and that's administered every week. The chemo is administered through a port I have inserted under my skin. It's actually, I'm not sure if you could see it, but there's a small scar here, and the port is actually right here, and they hook me up with a needle with a catheter that goes down into my neck and down into a vein near my heart, and that's how the medicine gets into my body. The treatment process, each time I go in for treatment, the first thing they have to do is check my blood work, my vital signs, make sure that I'm healthy enough to have the treatment, because it's poison. If they clear me for the treatment, then they hook me up to the system and they give me what's called the pre-meds. And now the pre-meds are to help with the side effects of chemotherapy, like nausea, vomiting, and all those great things, which, by the way, they work pretty good. Once I'm done with the pre-meds, they actually have pharmacists on site that are mixing your fresh chemo cocktail, if you will, right there. And then they have to administer that chemotherapy in the right order, in the right time frame. The whole process from the beginning to end is 4 hours. So each time I go in there, I'm there for 4 hours for the treatment. Now, since chemotherapy is a poison, basically, and it kills all not only the bad cells, but the good cells, after each treatment, I also need to have a vaccine done. Take a vaccine that's called Neulasta, and what that does is to help repair the good cells so that I could get healthy back enough and have my blood counts come back up again, so that at the following treatment I have enough blood counts to be able to do this again. This vaccine needs to happen right after 24 hours of your chemotherapy. That's when it works best. So what medical technology they have now is they have this patch-like injector. They stick it on my arm, and it's programmed to automatically stick me with a small catheter, and after the 24 hours, it beeps, it starts injecting the medicine, I can go about my day, it doesn't interfere me, it just beeps and tells me when it's finished, and it administers the medicine, and it avoids me having to go back to the doctor for another appointment and having the shot done manually. So that's a nice invention that they've come up with. I'm getting my treatments at the Harold Lever Center in Waterbury. They are part of the Yale and the Smilo group. The doctor, staff, nurses, everybody there is just amazing. I'm so blessed to have this treatment center so close to home, and not to have to compromise care for convenience. This past Monday, I had my second AC treatment, the tough one. I had it on Monday. By the third day, Wednesday, yesterday, I felt like I got hit by a truck. It's flu-like symptoms, it's nausea, it's everything that you could imagine, all lumped up in one. You basically are just exhausted and can't get out of bed. And it usually lasts through Thursday, through today, but it starts getting better as the day goes along. So right now, the only right now the tiredness has subsided a little bit. And each day after that, tomorrow I'll feel better, and the following day, and so on until I start the cycle again. They tell me that since this was my second treatment, hair loss is imminent. It's true. I've already noticed it. So I've decided so these lovely locks are going to be going soon. I've decided I'm going to shave my head and go bald. And you all will have to decide who rocks the bald head best, me or my husband, Frank. I did get a wig as a backup, just in case I lose my nerve. But the reason, getting back to the reasons why I'm sharing my story and journey, I want nothing more than to bring awareness to this disease. And after getting diagnosed, obviously, naturally, we do the research, and the statistics are astounding. Did you know that 1 in 8 women will develop breast cancer? That's crazy. Most of the time, you can't tell if someone has cancer because, we could hide the symptoms very easily with a wig, with makeup, with breast prostheses. And I'm not saying there's anything wrong with that. There certainly isn't. I have my wig ready, like I said, if I lose my nerve, and of course I'm going to be covering up my gray complexion with makeup. I'm not going to stop working, as I love what I do, and my work is a big part of who I am. And especially now, work is the only place where there is some normalcy and some sort of escape for me. So if need be, I will be prepared to use these tools to help me get through it. But a big part of me wants the world to see the cancer patient, and not because of sympathy, but as a reminder that although we have made huge strides in treatment, there still isn't a cure. Now, after all that being said and done, I want you all to know that my prognosis is good. This was caught very early. I have stage 1, no lymph node involvement. Yeah, the triple negative is a bad part, but the prognosis is very good. My doctors are very, very optimistic. I am an extremely positive person, as all of you know. You know I'm a fighter, so I know in my heart of all hearts I'm going to be okay. I know this is really long, and I'm sorry, but I wanted to start from the beginning. And again, I can't thank you enough for the amount of people that inspired me to do this. If you have any questions or comments, please send me a comment or send me a private message. If you want to continue to follow my journey, I will be posting these videos up periodically. Like the post, and I think you'll get it. And if you want to share it, if you find value in this and you want to share it, please do so, because this will only broaden the awareness of this disease. Again, I thank you for listening and following my journey. Until the next time, ciao for now. Bye.